Welcome to AI and the Human Connection. Today we're having Dr. Harvey Castro from Dallas as an MD and as an AI expert. If you can see the background, you can see that it says Dr. GPT. So we look forward to hearing all about that. Dr. Harvey, very glad to have you here, and thank you for accepting our invitation. Why don't we go ahead and start with yourself? Please tell us about yourself. What do you do so our audience can have a better idea who you are?
Yeah. So I'm a board certified emergency physician in Dallas, Texas. I've been proud to say I've worked over 20 years in the emergency room. Right now, I've divided my time into three pockets. One is doing this exact thing. I'm going around the world talking about how to use AI in healthcare. Number two, I'm actually advising different hospital systems, startup companies around the world on exactly the same AI in healthcare. And then
Mhm.
the third bucket that I'm spending a lot of time is I have my own AI ideas and things that I want to create. So I have my business partner and I create different AI products for healthcare and non-healthcare using AI. So it's been a lot of fun.
Yeah, you have a lot of hats, and you're helping a lot of people, especially in healthcare sector, to get to know more about AI. So my first question is going to be your bio mentions the journey from physician to AI strategist, as you mentioned right now. Could you share a defining moment that sparked this transition and your vision for the ideal balance between technology and the bedside manner?
Oh, this is a great question. So it was November 30th, 2022, and I opened up my computer and I literally stumbled across ChatGPT. And on that moment, I was going through it, asking it questions, and it just blew my mind. I thought, oh my gosh, this is amazing. And I'll never forget, I literally was in this office and my wife was in the kitchen, and I got out of the office and I went in there and said, honey, I'm going to write a book on ChatGPT, how to use this in healthcare. And I'll
Wow,
never forget
wow,
her
wow.
face. She's like, Harvey, I don't know what you're talking about. Like, what is ChatGPT? And so then I started explaining to her and how I'm going to teach doctors and I'm going to tell patients and I'm going to explain this. And she looked at me for a second and I could tell she thought I was crazy. She's like, honey, people don't know what you're talking about. I don't want you to people to think that you're crazy or that you got some crazy idea. Don't do it. And it kind of bothered me a little bit. And I said, you know what? I'm still gonna write the book. So I went ahead and started writing the book. And then she told me again, she's like, honey, like you got to give it some time because people won't know what you're talking about, and you're all got a book and you're way ahead of the curve, and they're not ready for this kind of stuff. She's like,
Hmm.
ask your friends, ask them what they know about ChatGPT. And then I started asking everybody. I took about a week, just everyone, my barbershop, fast food place, anywhere I went. And fast forward, I went ahead and published the book within a month on how to do it. And since that defining moment, it started as a public service announcement just to help people. All of a sudden, people around the world were calling me like, "Hey, can you come and give us a talk on this?" And hey, we would like you at our conference. And hospital systems were, "Hey, can you do this for us?" So it was really interesting.
Wow, that almost sounded to me like the moment the Archimedes, say Eureka, I found this, got out of his tub and running and this, I found this. It's so amazing. You saw the need in advance, and when you start doing that, the demand was already there. So many people, including me, are reaching out to you for this. So beyond the diagnostics and efficiency, do you see a potential role for AI in addressing the emotional and spiritual needs of patients? As a doctor, and I'm amazed to hear that you provided care 20 years in the ED. So the maintaining the compassionate, human-centered aspect of healing. There's a lot of concern about whether the AI is going to be really like replacing human compassion, or how can it actually contribute to that side of human compassion healthcare?
This is such a deep question. I see it on as a bell curve. As a doctor and compassionate person, I'm very strict when I'm in the emergency room. I tell the nurses and teams, everybody included, do not call me by my first name. especially if it's a patient, make sure you call
Hmm.
me Dr. Castro. And it's not that I need to hear my name as doctor at all. It's more because I really believe in that human touch and that validity. If they see me in a crisp white coat, very clean, very well pressed, and I walk in very professional, where my hands very clean, and you'll be surprised. Some doctors' nails look pretty bad out there, and I'm not trying to call any of them out. But then if you hear the nurse calling, "Hey Harvey," or "Hey, what's up?" Then the nurses are like, I mean, the patient's like, "Oh my gosh." But if they look at you and they're like, "Oh my God, this guy is studied," and they come in and you give them your hand, that touch, and says, "You know what? Everything is going to be okay. We're going to get this through together." That's powerful. And I don't see AI having that compassion and that
Mhm, mhm.
touch where it's like, "Oh my God, I believe it." Now, the other side of the bell curve, there are some individuals that say, "You know what? I love my doctor. I love everybody at the hospital, but I don't want them hearing this from my mouth. I want to share this with a bot." And I know that sounds a little different for some people, but some people really want to converse with the bot and open up their heart and say, "Hey, I'm embarrassed to say that XYZ is going on in my life." But what I'm telling my patients, it's like, if you feel that way, it's okay. Let's use the bot, let's extract it, let's get that, but please allow a human in the loop and make sure that
Mhm,
it's the
mhm,
right human.
mhm.
Maybe it's your wife, maybe it's your doctor. Ideally, I would say it would have to be a healthcare professional so that they can help you. So that way, maybe it's embarrassing to say it, but if the bot is summarizing and saying it and allowing the doctor to look at the transcript and go through that together, now I think we have something. Now I think we're able to combine AI plus human expert and give the patient more and
Mhm.
balance that compassion and make me more efficient to help provide the best care for that for the patient.
I hear that. So the example you use in terms of, having a, very crisp, the lab coat, it's similar to what we do as chaplains at the hospital we work. We wear those lab coats, which is not the case for many other hospitals. Actually, there were like even debates about whether we should wear that or not. But I saw that it helped a lot of times patients to see us as part of the caring team, not
Hmm.
like this is the medical team and then like the chaplain, but rather they see us as part of the team that we're here to provide compassionate care. And I also see that you emphasize the importance of having the human agency in the loop always, getting the help from the bot whenever it's necessary to boost our healthcare system, but at the same time always having the doctor, the physician in the loop as the agency.
Yes. Yeah.
Yes.
And I love what you just said. Let's extrapolate that. You said wearing the white coat, it shows that I'm part of the team. That's exactly it. I want, with our culture, with it changing, I want people to look at AI as just another part of the team. It's another
Hmm.
person, or I say it as a person loosely, but it's another tool so that
Yeah.
I can give the best care. It may not be the best, it may not be the worst, but it's another tool. Just like
Hmm.
when you come to the doctor and I order a CAT scan or an X-ray, but I look at them like, "Oh, this is wrong. I think the angle was not correct." Same
Yeah.
thing with AI. We need to educate our physicians and healthcare professionals to understand when it works and when it doesn't work and be able to get the
Exactly.
best of both worlds.
Exactly. Exactly. Thank you. My next question would be about this. A little bit related to our actually previous question. It's about overcoming the doctor-patient drive. So some fear that a more AI-driven healthcare system actually could isolate patients even further. Our healthcare system has a lot of good things, but has a lot of challenges as well. And one of them is this sense of isolation. So how can AI tools be designed to actually enhance that doctor-patient connection? You talk about this a little bit, but I think that's very important. So would you tell us probably like an imaginary scenario where Dr.
Yeah.
Castro is walking into a room with a bot? How would that be? How would that interaction look like from patient side?
Yeah. So I'm going to answer that in 2 seconds, but I want to bring this concept. It's similar. Instead of me having the power, quote unquote, of bringing the bot next to me and saying, "Here we go together," let's flip that. One of my
Mm-hmm.
ideas is, let's give you, the patient, the bot, and let's maximize that bot on your side. So before you come to the doctor, obviously assuming that you're not putting your patient's social security and HIPAA information, but let's just pretend that you're able to put it on the secure server that allows you to ask questions to me before you see me. And so,
Mhm.
for example, if you have diabetes, hypertension, high cholesterol, there's certain things that you want to know. But the thing is, if you're not a doctor or healthcare professional or new to the disease, you don't know what to ask.
Mhm.
So what if I tell you that I made this GPT for patients and that they could go in and put information and then it extrapolates questions. The average doctor patient only gets 13 minutes. That's it. So if those 13 minutes is a bot that you have control, that you have the information, that it formulates the right questions and follow-up questions, then before you even come to me, you're already ready for what you want to go over. And
Mhm.
then the next part, now to your question, I'm okay with telling my patients, bring a bot or let's have a laptop ready. Because when I speak to you, my brain is in the doctor world and
Yeah.
doctor words, and I
Yeah.
don't know your medical education level. And so sometimes by mistake, I may say certain things that I say, hey, did you understand that? And 9 out of 10 times, you're going to say, oh, yes, I understood. But in reality, you may not understand.
Mhm.
But if
Mhm.
I have the computer there or the bot that allows to transcribe and translate and then makes a transcription that you could take home, that you can go through and understand and be able to formulate questions, man, our healthcare system has just improved so much because just a simple communication, how to
Exactly.
take your medicines, compliance. I mean, there's a whole bunch of things that I had just fixed with that great conversation.
Exactly. I saw it many times, as a chaplain. I speak several languages, which helped me a lot. One of them is Spanish. We have a lot of patients who speak Spanish only. And sometimes the doctor comes in, gives an update. We're going to be doing this today. And then asks, do you have any question? And the person says, I don't. And the moment the doctor leaves, they say, hey, chaplain, I don't know what's going to happen. There's even that kind of sometimes barrier between the patient and the doctor. Sometimes people don't want to ask questions. So we started using this, live translators connecting directly with a person. And that communication really it helped a lot, the communication between the caring team and the patients. We're in Texas. We're at in one of the centers of the healthcare in the world. So just an imaginary question. When do you think it? I mean, I saw some hospitals, they're already using these like discharge nurses and AI actually talking through the computer to the patient. Okay, this is the medications doctor prescribed. Do you have any questions? These are the discharge orders and all that. So when do you think we're gonna start like seeing bots like walking into patient rooms? Do you think it's gonna happen anytime soon, especially in Texas, or do you think we're still far from that?
You know what's interesting? That's a great question. Yes, the answer is we will see that. Believe it or not, I just read a report in the last few weeks that China will have several robot doctors in their hospital, so that the robots itself can see patients. Now that will happen. The question that will happen here in the United States. And because of legal reasons and lobbyists and
Yeah.
multiple factors, I don't see that particular case happening just yet in the United States. But what I do see is I'm the doctor and I bring in a robot walking in with me that will do two things. Number
Hmm.
one, let's just pretend I'm older, I have a bad back, I can't lift too much weight. The robot will assist me lifting patients, walking the patients to the bathroom, and then be literally a physical assistant to help. But then that way, that gives me a less burnout, and then hopefully I can work into my old golden years because I don't have the power anymore, but the robot can help me. The second part will be the eyes of the robot. I know this sounds crazy. Will literally be an assessment. We'll be looking at you and saying, hey, based on his voice, his glucose is high. I know
Mm,
because we have algorithms.
mm,
Based on
mm.
a picture that I just took of his face, I know that his sugar is also high. I know his blood pressure. I know his age. I know his heart rate. And so all this information in real time can be relayed to me. Now, I
Wow.
know this sounds also creepy, but it has the technology that it's observing me. And so I'm examining you and I'm looking at you. And let's just pretend that the questions that you asked, I was supposed to look in your ears, but I forgot. The
Mm-hmm.
robot can tell me, hey, doc, take a look at his ears real quick. And then I can
Mm-hmm.
go through and then be like, oh, thank you. I forgot. Sorry. And then
Mm-hmm.
as I'm talking to you, the robot can go through and download all your information. And so it can help work together with me and say, okay, I would suggest the following. And then I can go through and be like, oh, you know what? I actually didn't think of that one. Let me roll that out. Let me ask you one more question. And you say it, then I know, okay, no, that one's rolled out. So I see a synergism. My favorite phrase is human plus
Mm-hmm.
AI is better than just human or just AI. I'm leveraging both to
Mm-hmm.
give you the best. And I really
Yes.
see that's going to
Yes.
happen, like I just explained, like that.
Thank you for mentioning that human and AI as more powerful than human alone or AI alone. It seems to me that we, I think, especially younger generations, are used to all these apps, right? I mean, we're more used to, check our, I don't know, blood pressure or heart rate or how many hours did I sleep, how many hours of it was good sleep. So I think we already have been interacting with, these apps for some time. So I think it's not going to be like a jump over a big gap, but we were already kind of walking that path. So I think it's not going to be totally novel, totally new. It's going to surprise us a lot, all the examples that you use, but I also believe that we already walk some part of that path.
Yes.
Yeah. So my next question is about the about mindfulness. As you know very well, especially since you work in the ED for all those years, a lot of people unfortunately quit healthcare, and that number is growing. It happened a lot during COVID. I know, people left from where I work, and a lot of places as well. So uh, a lot of people list burnout and list lack of time for themselves. The reason they're leaving, they don't have time to take care of themselves, all the traumatic things that they see every day. So do you think the AI could play a positive role in
Oh,
encouraging mindfulness practices for stressed healthcare workers? And how can we be sure that our healthcare workers are treated holistically? I do provide spiritual care to our staff as well, our nurses, but most of the time they don't have time. They barely have time to have lunch or to go to get some rest. So they don't really have time to sit down and talk. So where do you think that AI could kind of bridge that gap so that we can take care of our people, our staff better?
no, this is a great question. And the sad part is the technology is there. It's just that it hasn't been fully created, or if it's created, it hasn't been fully implemented. Let me give you a couple examples. There are algorithms and there are studies out there where hospital systems have been looking at their nursing. This was a nursing one that I'm thinking of, looking at their nursing staff and team that they have. And then they were able to use AI to start predicting which nurses were going to quit soon and which ones were going to leave. And believe it or not, the algorithm was very good. It was able to identify which nurses were going to leave and then was able to create interventions so that way they were identified. And a simple one would be if they came out on the list, the nurse, they had a follow up part of the study that would have to create interventions and they would meet with the nurse and say, hey, we understand based on some parameters that you may not be wanting to stay. And they're like, oh, no, I never said that, but I actually was thinking I do want to leave. And then they were able
Hmm.
to identify, okay, why is it that you want to leave? And then able to address it. So that's one way, using AI algorithms to identify who are high risk people of burnout and leaving. And then once that is made, simple interviews of seeing why do you want to leave and then see can we fix the system. You said very eloquently one of the first things is sometimes they don't have time for lunch, they don't have time to take a break. And
Hmm.
so making sure that we're able to create those things, and I know that's simple to say and doesn't happen, but to make sure that our healthcare force is strong. The second thing is I'm wearing an Apple Watch.
Hmm.
This thing, I can hook it up if I had diabetes to my sugar. There's something called an HRV, and it's the time between my heartbeats, and it says a lot about my stress. Simple things like this device to be able to monitor myself to say, you know what, my HRV is not doing too good. Maybe it's stress. And so that's where I'm saying if I could tie this to my work hours, my sleep hours, how much my schedule, as an ER doctor, I have to work days, nights, weekends, holidays, and my schedule is all over the place. And so that's a high reason for burnout. But there's some studies that show if you take the progression of the person from working morning, then the next week, middle of the day, then the next week, nights, it's a progression and they're less likely to burn out because you're slowly taking them, as opposed to today you work in the morning, tomorrow you work at night, today you work in the afternoon, and it's all over the place. And so having algorithms to say, you know what, the best flow is this, and putting that in the work schedule, that would be another way. And
Wow,
so my
that
bottom
sounds
line is
amazing. Yeah.
is using technology that we already know the studies, we already understand this, and then AI. And again, it's my simple thing, human plus AI, putting it together and helping us.
Thanks so much. So, mentioning this, like Apple Watch or other, tools that gather data, one of the major concerns about the use of AI in healthcare or in general is like who has access to this data and how is it being used? And, one of the biggest challenges in healthcare is the fragmented data. I go to a CVS here, there's a blood test there. I went to this clinic, there's some kind of stress test over there about me. So, but these data are not connected. So how do you think the AI could help in kind of helping together, bring together this fragmented data? And then the concern that who's going to have that data, and do you think the government should play a role in, kind of regulating certain things, who should have access to this data, or government should stay outside of this and let the healthcare field, healthcare sector figure it out for themselves?
Yeah, this is a tough one. Part of me wants to make sure that we move as fast as possible because I feel like there's so many solutions that can help people and it can save lives. There's a balance to that. Um, the other side is the government can put a wrench in all this. I know recently California is trying to pass a bill that eventually, if it does become law, could really hinder this space. And the summary is they created a bill that if your AI causes any damage, I think it's above $3 million, then you are liable for it, and any version of it. So example, if I invented an AI and I intended it to be for good, but then eventually someone took that technology and was able to scam people with it, I am responsible because they were able to take that information and use
Wow,
it for
wow,
evil.
wow.
And even if Meta, the Facebook owners, they created an open source Meta 3, and Llama, and if they give out that model out for free, and anyone takes that and converts any of that code to anything that can be seen as damaging or create damage or perceive damage, then Facebook is liable for that.
Wow.
And so I thought, man, this is going to hinder progression, because if that pushes, then the big guys that are making this stuff are not going to want to hand it down because they're like, look, I'm going to be sued. And so now that halts all this innovations, all these startups. And so that's the extreme that I'm worried about. Now, anyway, I hope that kind of answers your question.
Yeah,
So it's a balance.
thank you. Yeah, I mean, I think that's very interesting. This is the first time I hear about this in California happening, especially as a very progressive state. I'm,
Yeah.
surprised to hear that. It could, as you said, hinder, and it could actually stop a lot of people trying to be innovative and trying to do work because, well, I'm going to develop this, but I don't know, nobody wants to be sued for $3 million or something like that. So that's a big concern. As you gave examples from different places like China and California, and now I also want to ask you a question about like Europe. To me, it seems that Europe is kind of far ahead of us. Instead, in terms of the way they're talking about AI, and I saw today a guidebook for healthcare workers that was written back in 2022, I think in the United Kingdom, about how AI can actually help in healthcare. So do you think the Europe is, so to speak, doing a better job in terms of regulating this and getting all the players on the team comparing to us in the United States? As you get, the requests from different parts of the world, I wonder your opinions on this.
No, this is great. So in the United States, the way I see this world, I divide it in three pieces. We have the GDPR, we
Mm-hmm.
have HIPAA, and then we
Mm-hmm.
have California. And I believe if it's a if it's a spectrum, I feel on one side of that it's a GDPR, very strict, very hard when it comes to certain things. Then we have California kind of in the middle, and then we have the United States that's on the other side. That's like, okay, we'll watch.
Mm-hmm.
The beauty of this is that I really think that it's a combination of all three is molding the laws here in the United States. We don't want to hinder innovation, but at the same time, we don't want to create something that eventually is going to hurt our society.
Mm-hmm.
And so, I'll give you a quick example. Um, Sam Altman, the CEO
Yes.
of OpenAI, the guy who has ChatGPT, he went throughout the world and talked about ChatGPT. But then when he came back, uh, the GDPR, basically European Union, said to him, if you don't make certain changes in your privacy of ChatGPT, we will ban it throughout Europe. And it was actually banned for a season. He
Wow.
went back and changed ChatGPT, where now I can go into the history and erase it. Now I can make sure it's not recording anything because of that. And so that was one way where they didn't put any laws here in the United States because they can't. But they were told, hey, if you do this, we're going to ban you. And guess what? They changed it. Now with California, they're kind of in the middle. They're watching Europe. They're making some changes, and then so I really think it's almost like checks and balances. I feel like these three worlds are working together to make sure that indirectly that we have a better product for safety, and we're also moving forward. Very
Mm-hmm.
interesting.
Thank you. That's actually a very interesting answer. So you see the strengths of each of these three sides and how can actually help each other in strengthen these sides for each other too. Yeah, yeah. So I think one more question would be about what would you say as an expert now in both fields to a healthcare worker who says, okay, I don't want to lose my job in the future. I want to be, as they say, uh, AI is not going to replace a doctor, but a doctor who knows and is knowledgeable in AI is going to replace a doctor who doesn't. So there's that, fear of, job loss and all that. So what would you say to healthcare workers about like what kind of AI or machine learning, uh, so to speak, skills it would be helpful for them to acquire in the coming months or years?
Yeah, I think the number one thing to say is we need to be lifelong learners. We need to make sure that we're able to learn and that we're able to pivot. That would be the number one thing. Reason
Mm-hmm.
being is, you and I have been doing this for a while. Our job expectancy for this is short compared to the youth that's coming, compared to
Yes.
where they're starting. If we're having to pivot now, can you imagine how many times they're going to have to pivot? And if they're not lifelong learners to understand this, they're going to be behind. And so, again, I would say biasly, follow someone like me, follow my LinkedIn. I'm always posting, educating, showing how this technology been done. But don't just follow me, follow someone opposite of me. So that way you can see the spectrum of both sides. And I think that's so important because if I am not keeping up with AI and someone else is telling me, then guess what? You're going to let the hospital system, someone else drive it. But if you're learning and you're making the remarks and being part of the committees and being part of the hospital system and being part of the startups, now you're able to create change. You're able to say, you know what? Clinically, I've done this for 20 years. I think we should do it this way. And guess
Mm-hmm.
what? There's
Mm-hmm.
not many players out there. So you would be a huge influence for change and you would be able to mold it as opposed to you sitting back and just waiting to see what comes down the pipeline. Then you have no control.
Yeah.
So I'm going to encourage people be lifelong learners, be ready to pivot, And then at the last thing I always say is let's have fun while we're doing it because life is too short. We got to have fun with all this stuff.
Thank you, thank you. I mean, especially this your emphasis on being a lifelong learner. It's very important. There are these graphics that showed for 10,000 or so years, or probably more than that. Human beings have this like flat line, so to speak, in terms of civilization. I mean, at least majority of parts of the world. And then industrial revolution happens and it goes up. And now with the AI, it is like it is so fast. Even though we're in the field, it's hard to catch up with everything that is happening in the AI world. But I think if we're open to that learning, it's going to be a challenging job, that's for sure. But I think as long as we keep learning and we keep having it as a fun activity, I think it's going to keep us updated with everything that is going on. Yeah. So at this point, I'd like to ask as a chaplain question. A lot of things that one of the big part of what we do is really to provide spiritual support and sometimes help people find new meanings as with their new reality. I mean, you go to a hospital, now you've been told that you have a chronic illness, that you're going to have it for the rest of your life, or you just been diagnosed with cancer, stage 4, or suddenly they told you, the caring team told you that you need a heart transplant. So now you have a new normal, and it is really not easy to adjust to this new reality. So we talk a lot about meaning making. How do you make meaning of your reality in the middle of all this now? How does it affect your sense of connection with God, with the divine, with your sacred, with your family? So do you see that AI is going to also affect our sense of being, our sense of you talk about compassion, our sense of meaning making in this world? Do you think AI is going to affect that too?
Yeah, it's a new world. You and I are used to the traditional sense of life. You and I probably didn't grow up with, an iPhone. We didn't grow up with an
Yeah,
iPad.
yeah.
So our way our brain was molded down to the molecular level is totally different from the
Mhm.
kids today. The kids today are
Absolutely.
are used to this dopamine hit that they're seeing YouTube and they're seeing shorts and it's quick seconds. And you and I have to evolve that when we speak to them, we have to talk to them in sound bites. We have to be very quick to the point. If we talk too long, we've lost them.
Hmm.
They don't get it. And so as a result, if you mirror that to spirituality, they also, some of them have grown up where they had COVID in the sense that they didn't go to school. They didn't have that socialization. Also, some of them have been programmed more towards spending time on their iPads, on computers, and they're not spending as much time as you and I did growing up with that human touch and interaction and having to do things with our parents that we didn't want to because there was no other way. That was our
Hmm.
entertainment. Think
Hmm.
of the last time when you were a kid and you went on a road trip. It was very interactive. It was talking and hey, look out the window and playing games.
Hmm.
Now most kids, they are on an
On the
iPad, they
phone,
got
yes.
their AirPods on their phones, and there's no talk for a couple hours on a road trip. There isn't that same. So with that, I wanted to put it into perspective. Now, when you speak to them about spirituality, it's a different way of speaking to them. And so, what the answer is, I don't know. Maybe the answer is to talk to them through their phones. Maybe
Yeah.
their answer is to use technology to still give the same message and same principles, but now morph it because their brain is different. It's different from
Hmm.
ours. The
Hmm.
way of
Hmm.
seeing things is different.
Hmm.
So why should we speak to them the same? We need to speak to
Hmm.
them differently. And so will that change the way things are seen and felt? Yes.
Hmm.
Um, you know, and so is it the right way? No, but maybe it's a balance between how you and I grew up and how they're growing up and creating that hybrid to show that no, this is the better way. Your way is
Hmm.
good, our way is good, but if we come into a way that we both communicate, now we can speak to their heart easier. And so it's very complicated and every person is different.
Yes.
um,
Yes.
but it's fun because at the end of the day, I feel like our spirituality will guide us to the best way to communicate with that person. And that's that other force that I don't see AI replicating.
Thank you. That was really a wonderful answer. I really appreciate it. Again, hearing it as a chaplain, not only as an individual, but as a chaplain. That was a great answer. Um, I believe in human resilience. We are amazingly resilient creatures, and we adapt to a lot of things, right? So it's like similar concerns when the printing machines came out, and everybody said that this is going to be the end of the world, or the other things, or when internet came out, people said, no, we don't want that. Or sometimes I remember our parents complaining about, everybody's watching this TV, why don't you guys just sit down and talk? So I think this is going to be always a challenge from our generation to next generations. But I believe in the human resilience, and as long as we keep talking, I think we will be able to maintain our spirituality in a different sense, different way. But I think it's going to be part of us always. Dr. Harvey, I want to ask if there's anything you would like to add before we close our program. Anything you want to tell to our audience?
Yeah, for sure. The older I get, the more I realize I don't know. And the older I spend my years and time, I want to always reflect and tell others, make sure you take time every day, because you don't know if today is your last day. And I'm going to encourage everybody to, whoever that is that's out there, that's supporting you, that's in your corner, that's part of your village, that's part of your core, make sure you thank them, make sure you love on them. And for those of us that may have an enemy or two, or someone that we don't have peace with, make peace with them, because again, you don't know what the future holds.
Mm. Thanks so much for ending that with a tone of peace and taking care of ourselves and really appreciating life. As you said, we never know. Today might be our last day, so like one day at a time, and taking care of people around us. Thank you so much, Dr. Castro. I'm really honored to meet you, and thank you so much for your wisdom, for your knowledge, and also for really keeping the work and educating the community about this new age in many areas. So I also congratulate you for your efforts and look forward to hearing more about your works. Thank you so much.
Thank you.